From stories across the globe to stories here at home, this is the National News Broadcast. A very good evening to you. I'm Sharifa Tahir.
Good evening, I am Lakshita Gurusingha. We start off by taking a quick look at the top stories for tonight.
Colombo Port City Marina Promenade declares open for public. President extends his gratitude to the Chinese Foreign Minister for the material and finance assistance received from China in the face of the COVID-19 pandemic. Immediate response from the Chinese Foreign Minister to facilitate the return of Sri Lankan medical students to China following a special request by the Prime Minister. School academic activities to resume tomorrow. Scholarship and advanced level examinations to be held on scheduled dates. Required amount of COVID-19 vaccine doses for the nation has been received, Ministry of Health says. Vegetable prices decline. 200 killed from an attack in Nigeria.
We start off with the top story for tonight. The Port City Marina Promenade in front of the light vessel dock was declared open for public today. The ceremony was held marking the 65th anniversary of diplomatic relations between Sri Lanka and China and the 70th anniversary of the historic Rubber Rice Pact. The new Marina Promenade was declared open for the public with the participation of President Gotabaya Rajapaksa, Prime Minister Mahinda Rajapaksa and Chinese Foreign Minister Wang Yi. The people will be able to access the Port City Marina Promenade by foot, and a temporary entrance has been established in front of the Presidential Secretariat. Accordingly, the people will be able to reach up to the newly constructed footbridge. The public can access the Port City Marina Promenade from tomorrow between 9 a.m. and 6 p.m. daily. Prime Minister Mahinda Rajapaksa extended his gratitude to the government of China for the support extended to fight the COVID-19 pandemic. Reminiscing on how China's policies were adopted to create a self-sustaining country, the Prime Minister appreciated China's assistance towards country's economic revival and financial stability. He also said that China extended their assistance at the UNHRC in 2013 as a global leader on behalf of the nation. Marking the 65th anniversary of diplomatic relations between both nations, a Sri Lanka-China Friendship Sailing Tournament was commenced during the ceremony. The tournament was organized based on a concept of Minister Namal Rajapaksa. The championship trophy of the tournament, which was organized by the Embassy of China in Sri Lanka together with the Ministry of Sports, was presented to Minister Namal Rajapaksa by the Chinese Foreign Minister. A souvenir related to the China-Sri Lanka Friendship Sailing Tournament was presented to the Chinese Foreign Minister by Minister Namal Rajapaksa. Speaker Mahinda Yapabewardena, Ministers Bandula Kunawardena, Johnston Fernando, State Ministers P.L. Nishanta, Tharaka Balasuriya, former Prime Minister Ranil Wickremesinghe, former Speaker Karu Jayasuriya, Parliamentarian Premanath C. Dolavatta, Deputy Minister of Chinese Commercial Affairs Quan Keming, Assistant Chinese Foreign Minister Xu Jinghong and Ambassador of China to Sri Lanka Ki Seng Hong were present at this occasion.
Moving on to more stories, a meeting between the Minister of Foreign Affairs of China and member of the State Council Wang Yi and President Gotabaya Rajapaksa was held at the Presidential Secretariat today. The Chinese Foreign Minister engaged in an official visit to the country with the aim to further strengthening the 65 years of diplomatic relations between China and Sri Lanka. Warmly welcoming the Chinese Foreign Minister, President Rajapaksa recalled the historic close ties between the two countries. The President extended his sincere gratitude on behalf of the government of Sri Lanka and its people to the Chinese Foreign Minister for the material and financial assistance received from China in the face of the COVID-19 pandemic. Sri Lanka opened up again to foreign tourists under new normalization. The president requested Chinese Foreign Minister Wang Yi to assist in attracting Chinese tourists to Sri Lanka under the biobubble concept. The president pointed out that it would be a great relief to the country if the attention could be paid on restructuring the debt prepayments as a solution to the economic crisis that has arisen in the face of the COVID-19 pandemic. The president also said that if a concessional trade credit scheme could be initiated for imports from China, it would enable the industries to operate smoothly. President Wang Yi extended an invitation to the president to visit China and expressed confidence that the visit would take place in the near future. Foreign Minister Professor G.L. Piris, Secretary to the President P.B. Jayasundara, Principal Advisor of the President Lalit Veeratunga and Foreign Secretary Admiral Professor Jayanath Kolabage were also present. A meeting between Prime Minister Mahinda Rajapaksa and Chinese Foreign Minister Wang Yi held at the Temple Trees today, following a special request by Prime Minister Mahinda Rajapaksa on behalf of Sri Lankan medical students waiting to return to China to complete their studies. Foreign Minister Wang Yi instructed the ambassador of China in Sri Lanka to work closely with the Foreign Ministry to facilitate the return of Sri Lankan medical students. During the bilateral discussions between the two delegations, a host of other matters were also discussed, including further support for the vaccine program, attracting investments to the port city and the Hambantota industrial zone, increasing tourism from China to Sri Lanka, increasing Sri Lankan exports to China, and enhancing cultural cooperation, especially in the area of Buddhist ties. Following the discussions, the delegations signed the agreements on economic and technical cooperation, letter of exchange on the project of subsidized housing for low-income category in Colombo, handed over certificate of the technical cooperation project for BMICH, and also handed over certificate of the technical cooperation project for the kidney disease mobile screening ambulance vehicles. Foreign Minister Yi is on a one-day visit to Sri Lanka to launch the celebrations marking the 65th anniversary of Sri Lanka-China bilateral relations. Last year, the Central Bank of Sri Lanka issued a commemorative coin to mark the 65th anniversary. A set of coins were gifted to the visiting foreign minister by the Prime Minister. Conveying best wishes from the President and Premier of the China to Prime Minister Rajapaksa, Foreign Minister Yi said that China will continue to provide all the necessary help and support to Sri Lanka. Concluding the one-day visit, Chinese Foreign Minister Yi left the country this evening. Minister Nama Rajapaksa was present for the farewell ceremony.
School academic activities are set to resume from tomorrow in a normalized manner. Secretary to the Ministry of Education, Professor Kapila Pereira, said that schools will resume under health protective guidelines. Secretary to the Ministry of Education, Professor Kapila Pereira, said that this decision was reached in agreement with the President as well as the Director General of Health Services for the benefit of the students. He said that a vaccination program was initiated already targeting school children. He encouraged parents to direct their children to obtain their respective vaccine doses.
මේ අවුරුදු 12 15 දරුවන් සඳහා එන්නත ලබා ගැනීම සඳහා උනන්දු කරවන්න කියන එක පියෙක් විදිහටත් ඒ වගේම අධ්‍යාපන අමාත්‍යාංශය වෙනුවෙන් අධ්‍යාපන අමාත්‍යාංශයේ ලේකම්වරයා විදිහටත් සියලුම ආදරණීය දෙමව්පියන්.
He also made remarks over the scholarship and advanced level examinations scheduled to take place in future. Professor Kapila Pereira said that the decision to hold the scholarship examination on the 22nd of January and the GCE advanced level examination from the 7th of February was reached after inquiring children as well as the parents. He said that a decision has also been reached to conduct the GCE ordinary level examination will start on the 23rd of May this year.
The Ministry of Health says the COVID-19 vaccine doses required for the nation have already been received. Chairman of State Pharmaceuticals Corporation, Dr. Prasanna Gunasena, said that the vaccine doses required as booster vaccines have also been received. Therefore, he requested the public to receive their respective vaccine doses without being deceived by misinformation. Under the instructions of the President Gotabaya Rajapaksa on the 18th of January last year, the responsibility to import all COVID-19 vaccines to the country was vested with the State Pharmaceuticals Corporation. The State Pharmaceuticals Corporation was able to complete the importation of required amounts of vaccine doses to the country before completing 1 year since the beginning of the program. Accordingly, 6.8 million vaccine doses were received as donations, with China being the largest donor of vaccines to the country. Also, Japan, the United States, India and the World Health Organization have also donated vaccines to Sri Lanka. The government incurred a cost of $5 to $7.5 per vaccine dose. The total number of AstraZeneca vaccine brought into the country stands at 2,865,424, while 1.5 million Moderna vaccine doses were imported into the country. Also, 195,000 Sputnik vaccine doses, 26 million Sinopharm vaccine doses, and 18 million Pfizer vaccine doses have been brought into the country. The approvals for the vaccines were granted by an expert committee of the Pharmaceutical Regulatory Authority following a thorough study on the available data. As confirmed by the World Health Organization, the health authorities have indicated that the people in this country as well as in other nations are yet to develop any abnormal complications from the vaccination. The total expenditure for Pfizer vaccine has been paid through a loan assistance received from the World Bank. Also, the payment for Sinopharm vaccine was made through Asian Development Bank. The approval to make the payments for the purchasing of vaccine doses was carried out following a closely monitored procurement process and the completion of an audit over the entire procedure based on the agreements reached with these banks to prevent bribery and corruption. Accordingly, the entire vaccine purchasing process was carried out in a transparent manner based on international criteria. The national vaccination program is among the world's most successful inoculation programs. Chairman of the State Pharmaceuticals Corporation said that the institution was able to import high-quality vaccines to the country with the support of the Ministries of Health and Finance as well as affiliated state ministries. However, State Pharmaceuticals Corporation Chairman said that many have the fear, or rather many refuse to obtain the vaccines based on misinformation with the fear that they would suffer from various complications following the vaccination. However, he dismissed these claims and said that a disastrous situation would occur failing to receive the vaccines.
Consultant family physician Dr. Malkanthi Galhena says that the health protective practices should be adhered when children return to schools following the resumption of academic activities in schools tomorrow. She made these remarks while speaking to the media today.
The government schools will be open on 10th of January for all the students with full capacity. So there will be a higher risk of spreading this COVID disease among the society through these children. So because of that, all parents must be fully aware as well as fully trained and full advise your children to comply with all the necessary health protection measures as you and me are aware of. So as well as once the children coming from the school to the home again, so the parents must take responsibility to train them, to give them a proper sanitary measures before they enter into the home, like the washing of the body, bathing, or remove the clothes, and as well as remove the mask they wear, as well as the cleaning of the hands, the maintaining the distance if possible. Then chances of getting this virus through the children into the family will be very much less. And as well as the risk of spreading this infection among the school teachers as well as among the other staff members in the school will be higher if parents will not give proper the training for their children to take the necessary steps to maintain their health during the school time. The parents should educate their children to maintain the distance as much as possible and as well as to wear the mask properly and the cleaning of hands.
Taking a look at the global update of the pandemic situation as well, World Health Organization says the infectious Omicron variant of COVID-19 should not be categorized as mild, even though it produces a less severe disease than the globally dominant Delta strain. With a sharp increase in Omicron cases in recent weeks, many parts of the world are seeing an increase in hospitalizations, straining already exhausted health systems and workforces.
So Omicron, the latest variant of concern the WHO is tracking, has been detected around the world. It is efficiently transmitting, and in fact, everywhere where we have good sequencing, this variant is being detected. So it is circulating globally at the present time. It was first reported, in fact, in South Africa and Botswana, and in those countries, Delta was circulating at a low level. So Omicron took over quite quickly in terms of circulation to become the dominant variant circulating. In other parts of the world, Delta was circulating intensively. And so as Omicron was introduced into those populations, what we're seeing is co-circulation of both Delta and Omicron. Now, in some countries that have had a few weeks of circulation of Omicron is taking over. It's replacing Delta. But in other countries, that hasn't taken place yet. What we are seeing is a very sharp increase in case numbers. You will have noticed in the latest WHO update, almost 10 million cases reported in the last 7 days. And that's the highest number of cases we've seen to date. In the last 24 hours, it's been almost 2.5 million cases, or more than 2.5 million cases. So there are several reasons why we're seeing such a sharp increase in case numbers. First is the emergence of Omicron and the circulation of Omicron, which transmits very efficiently between people. There's a number of reasons for this. First is the mutations that it has. The virus is able to adhere to human cells more easily. It has mutations that allow it to do that. Second is that we have what is called immune escape. And this means that people can be reinfected, either from if they had a previous infection or if they've been vaccinated. Now you have to remember, vaccines are incredibly effective at preventing severe disease and death, but they don't prevent all infections and they don't prevent all onward transmission. So it is still absolutely critical to get vaccinated because it will save your life, but it doesn't prevent all infections or transmission. The other reason is that we are seeing replication of Omicron in the upper respiratory tract, and that's different from Delta and other variants, including the ancestral strain, which replicated in the lower respiratory tract in the lungs. And so these combination of factors allow the virus to spread more easily. But what is also important to remember is that this is in the context of people mixing more, people coming into contact with others more, people not adhering to public health and social measures like distancing, wearing of a well-fitting mask, avoiding crowds, spending time more outdoors and indoors. And in the northern hemisphere, where it's getting colder and we're in the winter months now, people spend more time indoors, and particularly in crowds. All of those factors allow viruses to spread, whether it's Omicron or something else. With regards to the severity of Omicron, we're learning more about this every day. What we understand from a number of countries, and the studies that are coming from a number of countries, is that your risk of developing severe disease or needing hospitalization from Omicron is less compared to Delta. That doesn't mean that it's a mild disease. It does mean, though, that if you are infected, that your chances of needing hospitalization are less. What we do know also from a number of countries is that your risk of developing severe disease increases with age, and that's the same as with Delta. It also and of course, it's increased if you're not vaccinated. So this is why it is so critical that when it is your turn, that you get vaccinated, that you receive the full dose. Because vaccination is saving lives. Vaccination is preventing people from developing severe disease as well as going on to dying. And that's true for Delta as well as for Omicron.
And in the meantime, India saw a surge of over 159,000 fresh COVID-19 cases and more than 320 deaths in the last 24 hours. The country's Omicron tally has mounted up to 3,623. Accordingly, 159,632 new infections were recorded in India, pushing the case count to 35.5 million. With 327 new deaths, overall fatalities stand at 483,790. Several states, including Tamil Nadu, Delhi, Maharashtra and Bengal, have imposed night and weekend curfew to mitigate infection spread, while health officials said Omicron is now the predominant strain circulating in Indian cities. Health experts have said that the present surge of cases in the country indicates a third wave of the pandemic. Meanwhile, new Omicron or new coronavirus infections are rising rapidly across France as the new Omicron variant takes hold. The country recorded more than 300,000 new cases for the second time in a week on Friday, and admissions to intensive care wards are rising steadily, putting healthcare systems under strain. France is one of the most highly vaccinated countries in Europe, with more than 90% of over 12 eligible for the shot fully vaccinated.
Back here in local stories, the price rates of vegetables which were increased in the recent past have considerably declined at present. Traders allege that organized entities are in the effort of increasing the vegetable price rates artificially. The rates of vegetables at the Special Economic Centre in Kapetipola, which is the main distribution point for vegetables in the upcountry, have declined considerably. Accordingly, the wholesale price of a kilogram of cabbage, which was at 220 rupees in the past, was indicated as 110 rupees today. The wholesale rate of radish, which was at 120 rupees, has declined to 50 rupees. The wholesale rate of 1 kilogram of brinjals has reduced to 180 rupees from 250 rupees. A kilogram of beans, which was at 450 rupees, is now priced at 230 rupees. Meanwhile, a kilogram of beet has declined to 150 rupees, while a kilogram of tomatoes was sold at a wholesale rate of 120 to 130 rupees. The wholesale rate of 1 kilogram of capsicum has reduced to 450 rupees today from 600 rupees. A wholesale rate of 1 kilogram of green chilies rated at 800 rupees was indicated as 500 rupees today. A kilogram of potatoes, which was priced at 240 rupees, was sold between the rates of 180 to 220 rupees. Meanwhile, wholesale purchasing of vegetables in Nuwara was carried out at reduced rates than the Kapetipola Special Economic Centre. However, consumers allege that even though the wholesale rates have declined, the retail price rates are yet to be reduced accordingly. Tamil Economic Centre traders have said that wholesale rates of vegetables have reduced considerably. Yet, they have alleged that the organized acts of intermediaries involved in trading activities have curtailed the benefits of price reductions from reaching the masses. Also, vegetable price rates in Colombo-based economic centers and fairs have reduced considerably.
Ministry of Finance says the 1,000 rupees supplementary allowance extended for Samurdhi beneficiaries will begin from the month of January. This supplementary allowance will be extended for Samurdhi beneficiaries under the relief package introduced by the government, considering the living condition at present. Accordingly, the supplementary allowance will be provided for 1,793,000 Samurdhi beneficiaries in the country. The supplementary allowance will be extended for the beneficiaries in addition to 3,500 rupees worth monthly allowance. The supplementary allowance will come to effect from the month of January. In addition to the 3,500 rupee allowance, the state allowance will be extended in comparison to the monthly allowance provided for individuals who receive the Samurdhi allowance under various categories. The 1,000 rupee allowance will be provided throughout this year.
Vadda community leader Uruvarge Vannilatto expressed his views to the Presidential Task Force for One Country, One Law. The Presidential Task Force for One Country, One Law is currently conducting public consultation in the Uva province. The members of the indigenous Vadda community were consulted at the Mayangana indigenous village on the 6th, and Uruvarge Vannilatto presented proposals and views on behalf of his community. Vannilatto said he believed that the President had the strength to establish One Country, One Law concept and extended wishes to the President in overcoming any obstacle when implementing the concept. The program was launched yesterday at the Badulla District Secretariat. Meanwhile, speaking to the task force, Ms. Hashina said she was married according to Islamic laws and the Badulla Qazi had unjustly announced her divorce from the husband without any notice. She added that the implementation of the One Country, One Law program was important because there was no one to talk about the injustice caused to Islamic women and that there is no one to pay attention to them. Representatives of several generations who took the lead in the Uvavellas freedom struggle and were deprived of land rights by the British rulers commented that the country's land law was still not being fairly enforced. Although their families took the initiative to save the country from foreign invasions and consequently lost property and lives, they said that no justice had been rendered so far even after the independence. The rights of people living all over the country are not enjoyed by the Tamil people in the plantation sector, and all stakeholders should pay attention to this. Representatives of several plantation sector organizations informed the task force that the land issue was also a major issue faced by the people in the plantation sector. Chairman of the Presidential Task Force, Venerable Galagodatte Gnanasara Thera, members of the task force, Professor Shanti Nandana Vijay Singha, Senior Lecturer Sumedha Veerawardena, Attorney at Law Sanjay Marabe, Iranda Navaratna Panivavala, and Secretary to the task force Jeevanti Senanayaka were also present. Meanwhile, a luxury train service from Colombo to Kankasanture was launched this morning. The ceremony was held with the participation of Minister Pavitra Vanyarachi. The luxury train service was commenced as a further step towards improving the quality of train services. The train will leave Mount Lavinia railway station at 5:10 a.m. daily and reach Kankasanture at 12:17 p.m. on the same day as per the train schedule. The train will leave Kankasanture at 1:15 p.m. and reach Mount Lavinia at 8:25 p.m. The train, made in India with the latest technology, consists of 10 compartments and 2 power engines. The train compartments are fully air-conditioned. The railway department has also taken steps to provide all facilities required by the passengers in the train service, including comfortable seating, a buffet car for dining, television and modern toilet facilities. The railway department has said that passengers hoping to avail the services of the train will be able to purchase e-tickets via the online platform a month in advance. The value of the train purchased under the Indian Credit Line scheme is at 2,500 million rupees. The railway department has set up a special security arrangement for the safety of the train. Inaugurating the train service, Minister Pavitra Vanyarachi travelled from Mount Lavinia railway station to Colombo Fort railway station. General Manager of Railways Dhammika Jayasundara was also present at the occasion.
Popular Sri Lankan singer and entertainer, often regarded as the king of Baila, Desmond St Silva passed away in Melbourne, Australia today. He was 77 years of age at his demise. Late Desmond St Silva, who was widely regarded as a pioneer of the Sri Lankan Baila music scene, had showcased his various talents as an entertainer, performing in Sri Lankan pop groups as well as musical concerts. Born in 1944, late Desmond St Silva had represented Sri Lanka in various international platforms in music. Featuring widely on the radio salon with his musical renditions, he then formed Desmond and the Clan Group in 1976. Late Desmond St Silva, who was a renowned singer in the 70s and 80s, toured and performed in many countries including Western Europe, Southeast Asia, India and the Maldives in both Sinhala and English languages. His albums including Yana Ratavate, Chudamanike, Baila Rajye and Raja Sangabo are still hailed as musical masterpieces in the Sri Lankan music industry.
And that's all the stories for tonight. Join us tomorrow at the very same time. Good night.
Have a pleasant night.